The first human trials in Europe of a coronavirus vaccine has begun in Oxford in what is a highly significant moment.
Let's discuss the latest research on finding a vaccine to fight against COVID-19. Under normal circumstances, a vaccine program takes over 5 years to develop a vaccine. Due to the urgency to control the spread of the present virus being further attacking people, the researchers are attempting to produce one at high speed within 1 year. It is heartening to know that the scientists at Oxford University have begun clinical trials of a coronavirus that has shown promise in rhesus monkeys, and the first dose could be injected to humans within another few months. You are aware that the common cold seasonal virus is called adenovirus. This is a virus that causes a range of illnesses. They can cause cold-like symptoms, fever, sore throat, pneumonia, pink eyes, and so on. These viruses cause upper respiratory tract infections, unlike the coronavirus, which attacks the lung tissue, causing a condition called lung fibrosis. A weakened version of the common cold virus is made that can infect chimpanzees. The adenovirus has been genetically altered to make it impossible for the virus to attack humans. This vaccine will be tested in healthy volunteers first. The purpose is to find out whether this vaccine will protect against the coronavirus. This new vaccine is called ChAdOx1. Now the next step is to add the same genetic material found in the spikes of the virus.
Matt Hancock announced yesterday that Britain is leading the research efforts to find a vaccine for COVID-19.
For all the efforts around the world, 2 of the leading vaccine developments taking place here at home at Oxford and Imperial.
This genetic material found in the spike protein is called glycoprotein. This protein is usually found on the surface of the COVID-19 spikes, plays an essential role in the infection pathway of the virus. It is hoped that the body will recognize this weak vaccine with added genetic material, will develop an immune response to the spike proteins that will help stop COVID-19 virus from entering the human cells and therefore prevent infection. Genetically modified weak vaccine ChAdOx1 has been shown to be safe and well tolerated by the 320 people on the trial, except for some mild side effects.
Professor Sarah Gilbert, who is leading the Oxford trials, says she is 80% confident that her vaccine will be ready by September. Her team has also set a target of delivering 1 million doses of the vaccine by that month. The work began in January to find a vaccine and is being developed by the clinical research teams at the University of Oxford's Jenner Institute. Other research for a vaccine in the UK is also being conducted by Imperial College London and the University of Southampton. Imperial College has asked for healthy volunteers aged between 18 and 55 to take part in vaccine trials, paying up to £625 for participants to take part. Researchers at the University of Southampton will lead a study with 510 healthy volunteers aged between 18 and 55. However, Professor Saul Forst, who is helping to lead the work to find a vaccine at the University of Southampton, warned there are not currently any licensed vaccines or specific treatments for COVID-19, but vaccines are the most effective way of controlling outbreaks, and the international community has stepped up efforts towards developing one. Meanwhile, Renowned British scientist Sir Andrew Whitty, former chief executive of GlaxoSmithKline, is set to lead a new UN task force aimed at boosting the manufacturing and distribution of a vaccine around the world when one becomes available. Around 80 groups, according to the WHO, around the world are attempting to develop a COVID-19 vaccine.
The future is hopeful, and within the next 3 to 4 months, Oxford vaccine should be ready for the public. The vaccine is made up of a weakened version of the common cold virus combined with the same genetic protein on the surface of the spikes should train the body to recognize and develop an immune response to the spike protein. That would prevent COVID-19 entering the human cells. So the future is promising. And meanwhile, shall we all continue working on the social distance to keep the virus away from people? Hope this discussion was useful. Please look after your health and stay safe. Goodbye for now.